This is a CVN special report reporting on the late-breaking clinical trials from EuroPCR direct from Barcelona. With me is Dr. Vasilis Babalieros, my colleague from Emory, who is in Barcelona. Vasilis, today's trials are a mixed bag. We have two negative trials, the paclitaxel-eluting balloon trial and the stem cell trial, but two very interesting trials having to do with stenting. So let's start with the negative trials to begin with. We have stem cells for myocardial infarction and paclitaxel-eluting balloon versus paclitaxel-eluting stenting in small vessels. What came out of those two trials?
Peter, the intracoronary stem cell trial for acute MI was negative, as you stated. It was interesting. They injected bone marrow cells in a much higher quantity that's been used in any other trial, actually 381 million mononuclear cells. But basically, despite this, when you follow these patients up long-term, there's no improvement of ejection fraction, and which was the primary endpoint, that the ejection fraction would improve by 3%. Likewise, there was no difference in infarct size or LV volume. So all in all, this kind of reiterated what we know, which is so far this stem cell therapy has not seemed to be working for ST elevation MI.
I agree, Vasilis. Another disappointment for stem cells. Let's move on to paclitaxel-eluting balloons.
This was comparing the paclitaxel-coated balloon versus the Taxus stent. As opposed to comparing it to another balloon, they decided to compare it to a stent this time. Unfortunately, the restenosis here at 6 months was over 30% for the paclitaxel-coated balloon and was less than 10% for the Taxus stent. So this was also a negative study. It was geared to show non-inferiority, but in fact was much inferior to the stent.
All right, well, two rather disappointing trials. So let's go to the good stuff. We have a trial which talks about in-stent restenosis. That's an issue because is this a benign situation or not? So in-stent stenosis, good or bad, hard or not so easy to treat?
This was an interesting prospective registry from Sweden. They looked at 6,000 patients that had restenosis. 5,000 of them had restenosis from a stenting procedure and 1,000 after a ballooning procedure. Interesting that we've always been taught that restenosis presented as stable angina, but they found something quite the opposite. About 60% of patients were presenting with unstable angina or ST elevation MI. Turns out that if you have restenosis with a drug-eluting stent or with a balloon, you're more likely to present with unstable angina. If you have in-stent restenosis with a bare metal stent, you're more likely to present with ST elevation MI. So not a benign condition.
Well, rather important information coming out of that trial. Let's move very quickly to end up with the last trial, which is the rapid healing business with OCT. Is there a difference in stents, and can you see the healing process with OCT to evaluate whether or not a patient is in trouble? What did they teach us?
This was a very interesting trial, Peter, because OCT is still in its infancy, but they were able to study approximately 40 patients that had stenting with either a bare metal chromium cobalt stent, a drug-eluting stent, or even a new stent called the Catania stent that's covered just with anti-inflammatory polymer, no other drug other than the polymer. And they were able to use the OCT to determine whether within 7 days or within 30 days there was coverage of the stent, the strut, that is.
So it sounds as though OCT may embark on a new journey, which is trying to figure out whether we can stop dual antiplatelet therapy. Is that possible?
That's absolutely right. Certainly, like you would expect, the drug-eluting stents at 7 days and 30 days had the same coverage. Actually, 15% of the struts were uncovered, whereas BMS and this Catania stent were able to cover the majority of the stents. Only 5% were left uncovered at 30 days. So I think it's really exciting that we may be able to start to predict who's going to develop stent thrombosis in the future.
So important new information from these late-breaking clinical trials from EuroPCR in Barcelona. Thank you, Vasilis. I'm Peter Block, and this is CVN.